Most people will come in the neighborhood of 8 o'clock in the evening, and this sleep lab is going to be running studies 7 nights a week, so we can usually find a night that works for people's schedules. They will stay overnight in the sleep lab and leave by about 6 or so in the morning. Yeah, the individual sleep lab rooms are actually set up to look more like a home bedroom or a hotel bedroom. Our goal is that this is to seem nothing like a hospital stay, because it isn't a hospital stay. While people will stay overnight, we want them to fall asleep, and doing that with a hospital-like look would not work. So there will be a regular bed, there will be a nightstand, there will be a flat panel television in the room, and there will be a technician for every 2 patients that are here to make sure that any needs are taken care of. We do encourage people to bring their own pillow, their usual night clothes. If they choose not to wear night clothes at night, then we do encourage them to wear night clothes here. Each room will have its own bathroom with a toilet and a sink, and each room will also have its own shower. People can then come in on a weeknight, stay for their study, get up in the morning, take their shower, go right to work from here. So that's a very convenient thing if people don't want to use up a weekend night in the sleep lab. Well, if we're talking about the disorder that most people are talking about these days, which is obstructive sleep apnea, then the common symptoms include snoring, excessive sleepiness, and someone else witnessing you stop breathing in your sleep. Most people say, well, I don't snore, but that's because they're asleep. So we really are dependent on having a bed partner or someone else in the household who can speak towards whether they actually snore or not. A classic type of snoring associated with a witnessed apnea would be a snore, 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 and then there's a pause lasting 10 seconds or so, and then that's often followed by a louder than average snore, which is the person waking up, their throat muscles start to open up their throat again, and a louder than average snore takes place because there's a big rush of air. Would be high blood pressure, heart attack, stroke, and possible worsening of diabetes. They're still working out whether it can contribute to diabetes in the first place. The other part of this is motor vehicle accidents and workplace accidents. If you're tired a lot, you can get into a lot of trouble behind the wheel. You can get into trouble if you're operating heavy machinery. I've worked with some other sleep labs in the past, and this gives us an opportunity to really take it to the next step and give Western St. Charles County a quality product to take care of twice the number of patients we had been taking care of when this lab started out as a fledgling operation in Wentzville several years ago. So we're going from 2-bed lab to 4-bed lab, so we can double the number of patients seen in a year. That's a fabulous opportunity for the patients of St. Charles, Lincoln, and Warren counties.